is that we know that school districts do not exist as islands unto themselves. Teachers may travel from other parts of the state. Students may be coming in from other parts of the state. So we wanted to provide a high enough level of analysis so that school administrators could have a global view of what's going on, not just in the zip code that the school is in, but in the surrounding area. Because if we've learned anything during COVID-19, it's that you can't just take a look at what's happening on your street. You've got to take a broader look what's happening all around you. And that's why we provided the analysis at the county level. It's just that, as Commissioner Macon mentioned, it's one piece of guidance that school administrators can use among many as they are making their assessments about how to approach in-classroom education in the fall. Now, you noted the questions about how we go about this. Well, it's a mixture of quantitative factors and qualitative factors. Some of the quantitative factors among many that we look at are things like positivity rates, numbers of new cases, as well as reports from clinicians across the state about what kind of symptoms people are coming into their offices with. There's not a strict cutoff for any of these because it's a blend of all of the factors that we take a look at. You're right that there are some counties that have rates that are different from others. That's to be expected in any large state like ours. But we also have to set those in the context of what's going on nationally. So although there is variation within the state, when we compare the counties in Maine relative to what we see in other counties nationally, we see that even the counties where there is more COVID-19 still fare and look better than what we've seen in other places. The qualitative factors that I mentioned are equally important. This is not a pure numerical calculation. So for example, if there were an outbreak in a county that otherwise had low numbers, but that outbreak were focused on a childcare setting or an after-school program where children are likely to be visiting, that might change our analysis as well. So we take all of these things into consideration as we're providing this guidance.
And I'll add just a couple points. One, as a reminder, is that we do know some of our counties are relatively large. There may be a county that at some point is yellow, where there are parts of it that may be able to, maybe parts of those counties where community transmission is relatively low, and those school districts may opt for more children in classrooms, and vice versa. There may be green counties where, again, this is not green, go back to pre-COVID days, this is green, you can open your schools if you meet those 6 requirements that are on the Department of Education website, if you have the sufficient space and capacity to do so. There may be school districts in counties that are green that may choose to delay or do hybrid learning. So this is just a set of recommendations. We appreciate that counties are relatively big, but as Dr. Shaw said previously, children often come from different parts of the state, crossing county lines. Teachers often cross county lines. So we appreciate the fact that it's not as refined as some would like, but we also think it gives that larger view that is important as our school districts make their decisions.
I'm going to turn next to Robbie Feinberg at Maine Public.
Hey there, Dr. Shaw and Commissioner Macon, Commissioner Lambrou. My question, I think, is primarily for Commissioner Macon. I wanted just an update on securing PPE for districts, particularly with all of the counties getting that green rating. I imagine we'll probably need more PPE within a month. So what is that going to take? What's the role that the state is playing there in order to secure it? Will we have enough when schools do reopen?
Right. Thank you so much for that question, Robbie. We have months ago, in fact, we started working with MEMA and with the state to procure, make sure we could put our hands on the scarce resources that are out there. And they have all been ordered, paid for at the state level. So this will be offered at no cost to Maine's public schools and to the schools who serve Maine public students. And districts have placed their orders. We sent out order forms. Some of the PPE is already in warehouses in the state. And I believe we are mobilizing a National Guard to assist in the delivery of these very important items to all schools. Among the things we ordered include masks and cloth face coverings, some with the clear panels for children who struggle with reading lips or need to observe nonverbal cues or learn phonics. It also includes face shields hand sanitizing gel, and other types of PPE that are going to be necessary for more close contact situations. Much of it, as I mentioned, is already here in the state, and we do expect another delivery sometime in the very end of August, early September. And we'll be making that available as quickly as we can to all schools.
Thanks, Robbie. I'm going to turn next to Brian Sullivan at WABI.
Thank you. And this question is for anyone who feels comfortable answering it. If all counties are being classified as green, but I think you just said, Dr. Shaw, that if a outbreak was to happen in a county where it was classified as yellow, that school district could then choose, if it was more centralized to another school, they could choose for in-person learning, even though they're classified as yellow. So why designate them by colors if it's really more on the local school to make these decisions?
Yeah, Brian, I'll start and welcome the commissioners as well. These designations are intended to be guidance to help administrators get a sense epidemiologically of what's going on in their neighborhood. A lot of the numbers that epidemiologists talk about, there's a lot of them, and they can be difficult to have context around. So what we wanted to do was to take those various and distinct pieces of data and try to distill them down for non-epidemiologists to get a sense of what's going on in the world around them. Now, I want to be really clear about one thing. The green designation is important, as all counties are green right now, but that designation is predicated on use of things like face coverings in schools. It assumes that students and teachers will be wearing face coverings. It assumes proper social distancing. It assumes all of the other safety guidance that the Department of Education has put out are being effectuated at the school district level. The face coverings, far from being any sort of impediment in classroom education, should really be viewed of as the vehicle that allows us to get to green and hopefully stay at green. The other piece to think about when we think about these color designations, take green, for example. The green here is not like the green light at a drag strip. It does not mean you push your feet on the accelerator and go as fast as possible. The green light here is really more like the green light at like a car wash, right? You enter slowly, you look around you with caution, and you be prepared to stop at any time. That's really the way in which these designations are offered. They're cautionary so that school administrators have all the information from an epidemiological perspective as they're making their decisions on the ground. I'm going to turn now to Rachel Ohm at the Press Herald.
Hi, good afternoon. I have a question about what happens if a case is reported at a school. Would that change the designation for that school district, or what protocol should they follow? And does that change things for the county? And secondly, I was wondering if it would be possible to get a complete list of the metrics that you guys are using to make the designations.
Sure, Rachel, I'll start the first question and then we'll open it up on the second as well. So all summer long, Maine CDC, DHHS, and the Department of Education have been working on just the scenario that you outlined. We've done so with the benefit, with that is to say, the potential for a COVID positive case, either in a teacher or a student or staff member in a school. We've done so with the benefit of experiences from other countries where schools have remained open or stayed open or opened earlier than the schools here in the United States. We've come up with a system that is akin to how we investigate cases or outbreaks in other settings, namely healthcare settings. We've appointed a point person at the Department of Education, and we'll soon have a point person at Maine CDC who will be in contact with one another so that DOE can have tabs on what's going on from the public health perspective and vice versa. We'll approach these situations as we always do with the goal of public health in mind. Now, how those might affect designations really depends on what we see in any type of situation. So we really can't speculate about how, say, a single case in Piscataquis County might change the entire county's designation. It will really depend on what kind of facts we're seeing on the ground.
And on your question on which measures we use, we are using a range of measures. We don't have one single metric for COVID-19 that will tell us exactly what's going on in a locality. We think it's important to look at the whole range that includes, but is not limited to, recent data on case trends, positivity rates, and syndromic data, that is, that data on symptoms of flu or COVID-19. But we also look at qualitative information. We know where there are outbreaks. We know the nature of those outbreaks. We can really dig in and try to have a discussion about what do we know is going on in each of these counties. And that holistic, qualitative, and quantitative information will go into this recommendation, which again, we're going to update every 2 weeks. Things change. So while today, July 31st, counties in Maine are green, that may not be true in 2 weeks from now or 4 weeks from now. So we will continually monitor and update, and on this 2-week cycle, revisit to make sure that the county recommendations that we made are the same.
Is it possible to get the full list of at least the quantitative metrics?
I mean, I named 3 of them. We look at all sorts of data. I think that we are posting on our website the data that we use. So the Maine CDC website has that information on it. We look at that again, as well as the outbreaks that Dr. Shaw typically announces in his press conferences.
And Rachel, the data that Commissioner Lambrou just noted, are on our website, and they are broken out by county.
Okay, thank you.
Mm-hmm. I'm going to turn now to Patrick Whittle at the AP.
Thank you very much. Couple quick things. I'm curious if there are any parts of the state that are possibly greener or less green than others, like if any of these are sort of the equivalent of a swing state that could become yellow sooner than others. And also, I hate to make you repeat yourself, but I love the analogy about the car wash. I just want to make sure I have the syntax right, and I would love it if you could repeat that for me.
Sure thing, Patrick. So I'll start there. As we think about these color designations, I think it's important to note that the green lights here, the green designation here, is not like the green lights you would find at a drag strip, where green signifies pressing the accelerator as hard as possible and going as fast as possible. The green designation here is much more akin to the green light that you might see at a car wash, where green means enter slowly, looking both ways with caution, being prepared to stop at any moment. And then that's how the color designations are offered. Sorry, Commissioner, go ahead.
And I'll take the greener question. And we'll say that we think about these colors really uniquely for the Department of Education, because what we're trying to do is help Commissioner Macon, as well as all the superintendents and people in their communities, make informed decisions. So green is going to be a swath of, certain situations where, again, this is all about the number of children and people, teachers, faculty, et cetera, in schools. So in green areas, we think that the risk of transmission in the community is relatively low, not zero. We don't yet have a treatment or cure, but relatively low. That then goes to yellow, where we get worried. There might be something going on, so we want to give those decision makers some flags that they may think differently about hybrid learning. And red is that designation if we really feel as though there's a serious risk, like we experienced in the spring, of COVID-19 spreading dramatically or rapidly. That's when we go to red. And these colors are really just uniquely for schools. They're not for restaurants. They're not for other different sectors. We really are tailoring them to our colleagues in the educational community for precisely this purpose.
Thanks, Patrick. I'm going to turn to Joe at WMTW next. All right, we'll come back to Joe in a minute while we turn to Dustin at New England Cable News.
Hi, Dr. Shaw. I have 2 questions. The first is, how does Maine's plan stand out? Is it unique in any way compared to what we know about other states, perhaps those in the region? Secondly, what's the burden on our school nurses? And are each nurse's office throughout the state prepared equally for any situation that might arise out of an outbreak or something like that?
I can speak to how our state's framework measures up as compared with other states. We have been collecting all of them as they are published. We've had feedback that ours is a bit more concise. It's a little bit more specific in some ways, and it does take into consideration not only the health and safety factors, which are populated in the first section, but also social emotional considerations and academic considerations and logistical strategies that may be used in order to implement all of those things. And so we believe that our framework is very good. I think it might also be unique in that it was created by multiple stakeholders. We had a very large group who vetted and contributed and provided feedback into the framework that we have. And I forgot your second question.
Dustin, as for the school nurses?
Right. Our school nurses equally across the state prepared for what might happen. I can tell you that our State Department of Education health specialist and school nursing specialist has certainly equitably and equally reached out and has been working with the nurses and health professionals provision is what it says for the education of the children. And not all states are like that. Many states have much more responsibility for providing equitable services at the state level. And so that said, we are reaching out. We want to make sure that school nurses who are feeling under-resourced, and I believe they all do have a very good connection with Emily Poland, and she's our nursing specialist. If anybody's feeling under-resourced or nervous, they absolutely should be reaching out to us because we do have many supports to offer and resources.
Great. Thanks, Dustin. I'm going to turn to Taylor at WGME next.
Yes, thank you so much for taking the question. So I was curious about a student that might not feel comfortable going back into the school setting. How exactly is that going to be addressed at the school level? Would they be able to attend virtually, even if the majority of their classes or other fellow students are in person?
Well, so there may be many reasons why a student or an educator or school staff person would feel uncomfortable. And then there are other reasons that would make it actually not advisable medically for somebody to be out in public in a public setting. So there are two different levels. If it is a matter of not particularly a health concern, but rather an anxiety or a fear about returning, we are hoping that schools understand and that families and parents and students all understand that we'll be saying, at least at the state level, that it is not advisable to return to in-person instruction until it's safe to do so. And we wouldn't be setting up a situation or expecting people to send their children into a setting that we wouldn't send our own children into, or husbands, for example, in my case, who is a teacher in a middle school. So we are working very hard to make sure that everybody will feel safe enough to be at school.
And I'm going to turn back to Joe at WMTW real quick.
Yes, thank you, Dr. Shah. Sorry, I couldn't get through before. Just a quick question. You mentioned the 2-week updates for the statuses, and I wanted to know if there was a more significant outbreak in a school or even a collection of schools, how quickly the color system would be updated, whether it can be changed from day to day, or whether the change would not take effect until that 2-week period. and just in general how the superintendents will be getting this correspondence and how often they'll be updated about the general numbers and where things stand.
Great. Joe, I think I heard your question to be, would it be conceivable to update the color designations more frequently if conditions on the ground change? And what else? And then how would we communicate with superintendents and school leaders? As to the latter, Joe, if there were, say, an outbreak at a school, the school leadership in that area would most certainly be involved. The principals, the superintendents, the entire school leadership would be involved. At a minimum, they would be briefed on what was going on so that they may opt to make changes on their own based on the public health assessment that we might provide to them. So we think that that is the most efficient way to ensure that children are well and teachers and staff are protected at the ground level. It's less about changing the entire designation for the county and more about zeroing in on where there might be an issue and briefing all the stakeholders in that area to make sure they've got all the data so that they can make decisions in the moment. You know, you asked about changing the designations more frequently. Depending on how things were changing statewide, it's conceivable that we might change the cadence of those updates, but there's also a need to make sure we're providing for stability and continuity throughout the educational system. So changing things on a day-to-day basis could introduce more of a whipsaw instability into education than would probably be warranted. So we're trying to balance those two things as we go through analyzing the data. Haven't made any final determinations. We want to be flexible, but that's how we're thinking about it right now. Commissioner?
I'll just add 2 points. One is that there's also a challenge in a state like Maine that's relatively small. So you really, to see a trend, it may be that small numbers change and it looks like you're doubling a rate when it's actually a very small change in number terms. So 2 weeks gives us a chance to see if what we're seeing is really a trend in one direction or the other. And the second thing on communication, I would like, Commissioner Macon to talk about this as well, because she does communicate with her colleagues all the time. We are purposefully putting all of this information on the Department of Education website. So Maine CDC, Maine Department of Health and Human Services, we are assisting Department of Education in this effort. They'll be communicating all this information to their colleagues.
Great. Well, Commissioner Macon, Joe's question was the last question for the afternoon. So I'll turn things back over to you if you've got any closing comments for the afternoon.
No, I just want to say how wonderful is it that we are a state with all counties showing a green rating. And I think that it has everything to do with the wonderful decisions you all have made at CDC, at DHHS, our governor's office, and again, to the commitment of the Maine people who take very good care of one another. So thank you for all you've done.
Great. Thank you, Commissioner Macon. Dr. Thibodeau, thanks for your assistance this afternoon. I'd like to thank everyone for tuning in. I hope everyone has a great afternoon and a great weekend. We'll all catch up again next week. Thank you.